wait another minute for everyone to jump in.
Nobody showed up.
Okay. Looks like we have a lot of people here ready to go, so I'll go ahead and introduce myself. Good afternoon. My name is Jonathan Modai. I am Lead Communications Officer at the Oregon Health Authority Public Health Division. I'm also one of the media public information officers working on the state's COVID-19 response. And we're delighted to join you all for this Wallowa County virtual town hall to discuss COVID-19. We very much appreciate the opportunity to be here with you and with our partners in Wallowa County to talk about our response. Next slide, please. I'm sure this is old hat to many of you who've done these Zoom meetings, whether for work or with friends or family. But we know that some of you may not be familiar with this platform. There will be an opportunity to ask questions after a brief overview by Dr. Dean Seidlinger, State Health Officer and State Epidemiologist. We will run through questions many of you and your friends and neighbors submitted in advance. And then Dr. Seidlinger and our panelists from our Wallowa partners will provide responses. We will then open it up to questions, and all you have to do to ask a question is click on the chat button at the bottom of your screen. You'll see a chat box open on the right side of your screen. You'll select Ask a Question, and then just type and submit your question. Your question will automatically be directed to my colleague, Patty Umfred, who's on this call, who will read it aloud, and our panelists will work to provide a response. Next slide, please. If you want to listen in Spanish, all you need to do is click on the interpretation button at the bottom of your screen, select Spanish, and you will hear the Spanish audio for the meeting. Gabby, would you like to follow up?
Gracias. Si quiere escuchar en español, debe hacer clic en el botón que está en la parte baja de su pantalla, que dice Interpretation. Debe seleccionar Spanish y escuchará el audio en español.
Thank you. Next slide, please. We are recording this meeting this afternoon. That recording will be available on the Oregon Health Authority YouTube channel tomorrow, Wednesday. We will let our partners at Winding Waters and Wallowa Memorial Hospital, who are on this call, know when it's available, and then they will share that link to the video with the community. We expect that in addition to the questions we received in advance, you'll have a lot of additional questions in the open Q&A section. Those questions we don't get to during this virtual town hall, we will respond to in writing and share them with Winding Waters and Wallowa Memorial Hospital. Next slide, please. So let me introduce our panelists today. Dr. Dean Seidlinger, as I said, is the State Health Officer and State Epidemiologist at the Oregon Health Authority Public Health Division. Dr. Elizabeth Powers is a family physician at Winding Waters Community Health Center and Chief Medical Officer at Wallowa Memorial Hospital. And Jenny Word is Chief Nursing Officer at Wallowa Memorial Hospital. Next slide, please. As I mentioned earlier, Dr. Seidlinger will provide a brief overview of the county data, our process regarding case investigations, contact tracing, isolation and quarantine, what we know, what we don't know about the spread of the virus, the roles that OHA, Winding Waters, Wallowa Health District and community-based organizations play in the response. Dr. Seidlinger, Dr. Powers, and Ginny Word will then basically play tag team on answering the questions you submit through the chat. They will do their best, but if we don't know the answer, we'll try to get the answer and respond later in writing. And so with that, let me turn it over to Dr. Seidlinger.
Thank you, Jonathan, and thank you for my co-presenters who are going to help answer questions, and thank you all for taking some time to join us tonight. I could have the next slide. So I'd like to start off by providing a brief history of how we provide public health services in Wallowa County. Many of you recall that in May of 2018, the Wallowa County Board of Commissioners passed an ordinance that transferred public health authority, that is providing basic public health services to the residents of the county, from the county government to us here at the Oregon Health Authority. What that means is that OHA assumed responsibility for continuing services that it's statutorily obligated to provide to protect the public's health. And this included services like Women, Infants, and Children, or WIC, supplemental nutrition program that provides nutrition services for pregnant women and families with young children, drinking water services, environmental health licensing and inspections, the assurance of reproductive health services in the county, enforcement of the Indoor Clean Air Act, as well as communicable disease investigation and control, which is what we're going to talk about tonight. Next slide. To ensure that these services are provided to county residents, OHA partners with Wallowa Health District, Wallowa Memorial Hospital, as well as Winding Waters Community Health Centers, and several community-based organizations, including Building Healthy Families, the Wallowa Center for Wellness, UValkyrie, and the Eastern Oregon Center for Independent Living. We really value these partnerships, which have been crucial in our ensuring that folks in the county receive the best public health services that can be provided in the absence of a county health department. Next slide, please. Here's what we know about Wallowa County cases. As of November 16th, 2020, there had been 69 individuals in Wallowa County who'd become sick with COVID-19. Tragically, 3 individuals who've died. When we look at recent data, what we know from Wallowa County is that over the first 2 weeks of November, from November 1st to November 14th, there were 13 cases reported in Wallowa County. Sporadic case rates, which we use, rate cases that we cannot trace back to an individual case. When we look at, this is data from October, that 2 of the 16 cases could not be traced back to an unknown source as we did our investigation. That was a rate of 42 per 100,000, which is 3 of 8 cases and through 11/11. I think we post our data, not just for Wallowa County, but for the state as a whole and county by county on the OHA website at healthoregon.org/coronavirus, where we post weekly reports on data, some county dashboards that can help look at Wallowa County data. Next slide, please. I want to briefly talk about Oregon Statute 433.008, because many people ask, well, why can't you tell me where every case was in Wallowa? Or I'd like to know more about my neighbor. I think he has COVID. Why didn't someone contact me? I was at a party and I think someone had COVID. We fall back on this state statute that protects the confidentiality and privacy of individuals. We are entrusted with a lot of data in public health, and we want to make sure that, yes, we use that data to provide services to the individual to protect the public's health, but we want to make sure that we protect the privacy and confidentiality of the individual. The law does dictate how much information and data the Oregon Health Authority, as well as our local partners, are able to release, when we release, to whom, and under what circumstances. In each and every request for information about an outbreak investigation, we have to balance transparency telling people what may have put them at risk with confidentiality. And the law has really favored protection of confidentiality. That said, we recognize the intense public interest in our COVID-19 data, which we know helps people better understand how the virus is affecting their communities. But it can also serve as a way of encouraging people to take steps to protect themselves. For example, we have used data on intensive care unit bed availability, which we haven't released during other infectious disease outbreaks, to show how the severity of hospitalizations is happening across Oregon, and to show when we've seen a surge in cases in recent weeks. And it was some of this data about hospital ICU usage, as well as capacity that played into the governor's recent decisions as we assure quality care is available for everyone. Finally, I want to touch on some facts about, next slide, please. I want to touch on some facts about the governor's executive orders, particularly the recent freeze that goes into effect this week. The freeze is for a 2-week period starting tomorrow and will be reevaluated at the end. Some counties may be in a freeze for longer than 2 weeks if cases are high, and the governor specifically mentioned Multnomah County and potentially Portland Metro Region counties where case rates are very high. The governor's new order is really intended to help restrict the size of gatherings, as we know this is where COVID is easily spread. This is particularly true within indoor locations where people are in close proximity and often for a significant amount of time. Bars and restaurants are limited to takeout or delivery only. And this is because of what we've learned about transmission in bars and restaurants through the course of this pandemic. We know that this disease is spread primarily through droplets. So when someone coughs or sneezes to people or to individuals within 6 feet. But we also know there's a component of airborne spread. So as people talk or just generally breathe, that it can be put into the air and can spread even farther in an enclosed space. Our masks and face coverings go a long way to protect individuals around them. So what we know about bars and restaurants is that as we eat or drink, we need to remove our masks to eat or drink, so we don't have that barrier protection in place. We know that people sit at tables with their friends and family, often from outside their households in close proximity for a period of time. We've seen significant spread within bars and restaurants in several other states and cities. The vast majority of outbreaks linked to bars and restaurants in Oregon have been amongst employees, but we do see some spread to patrons in those settings. And we know that many people who report going to bars and restaurants more frequently also report getting together socially with friends and family in other locations. And it's often hard to tease out whether transmission happened in a bar or a restaurant or one of these other social gatherings. And what we've learned here in Oregon, as have others across the country, is that social gatherings really are a major source of transmission when people get together. We often get together with our friends, family, and loved ones, and we let our guard down. We may not wear a mask or keep people 6 feet apart. And this is when people get infected, often without even knowing it, as many people have no symptoms and can still transmit the virus to others. They go to work, they socialize outside the home, and that's really how we see the infection spread. So the governor has asked to limit their social circle to no more than 6 people and no more than 2 households during this freeze. There's also been a limit on faith-based organizations to a maximum of 25 people indoors or 50 people outdoors. This is an attempt to try and lower the risk as people to get together for a very important action, which is, praying and practicing their spirituality. As I stated before, bars and restaurants are limited to takeout only. Gyms and fitness organizations are closed. Indoor recreational facilities such as museums, indoor entertainment, indoor pools, and sports courts are closed. Outdoor recreational activities or facilities such as zoos, gardens, aquariums, outdoor entertainment activities, and outdoor pools are also closed during this 2-week period. And grocery stores, as well as other retail stores, are limited to 75% capacity. And we continue to encourage curbside pickup when at all possible. We've also closed venues. This includes indoor or outdoor events. This includes theaters and other places where people gather. and requiring that all businesses mandate work from home to the greatest extent possible and closing offices to the public. Lastly, to protect some of our most vulnerable Oregonians, it prohibits indoor visiting in long-term care facilities. We know this presents a significant strain on the individuals in facilities as well as their friends and families outside. But this is done because we know how easy it is for COVID-19 to spread in those facilities, particularly amongst the vulnerable population. Tragically, we've seen about half of our deaths in Oregon, as of many other states, be seen in residents in long-term care facilities. So I can't stress how important it is that organizations, businesses, facilities, and venues comply with the governor's freeze, as well as other executive orders that are really intended to help us bend the curve and start pushing the surge of cases we've seen downward. We know that the people in Wallowa County, as well as other Oregonians, are up to the challenge and want to do their part to protect themselves, their families, their neighbors, and their communities by continued actions such as practicing physical distancing, keeping 6 feet apart, wearing masks, avoiding gatherings, and staying home and avoiding any unnecessary travel. We know that these activities don't come without sacrifices, that our connection to others, the effect on our mental health have been great, but it's important that we keep these activities up so that we can decrease the spread of COVID-19, protect our hospital capacity so it's available for everyone in Oregon, whether they have COVID-19, suffer from a heart attack, or have a car crash. And with that, I'd like to turn it back over to Jonathan. I think we'll start our question and answer period.
Thanks, Dr. Seilinger. Once again, we will begin the question and answer period with the questions submitted in advance. I will kick it over to who I think might be best able to answer the question, but I encourage any of the panelists to chime in as they see fit. Afterward, to ask a question through Zoom, again, just click on the chat button at the bottom of your screen. You'll see a chat box open on the right side of your screen. You'll select Ask a Question and then just type and submit your question. Your question will automatically be directed to my colleague Patty, who will read it aloud, and our panelists will work to provide a response. So with that, I will get to our first submitted question. The question is, what happens if I test positive for COVID-19? Will someone contact me? How long will I have to isolate? How will people I have exposed know they are at risk? Dr. Steinleger, you want to take that one?
Sure. Thank you, Jonathan. I think, let me start by saying that if you test positive, your healthcare provider and the lab performing the test are required by law to notify the Oregon Health Authority. This follows communicable disease practice for reporting of tests so that public health can follow up. When OHA becomes aware of a positive test, OHA either will contact you directly or work with our partners, Winding Waters, to contact you to do an interview. The interview will ask you questions about yourself, possible risk factors where you may have gotten sick, and who you may have been in contact with. We consider close contact being within 6 feet of another individual for 15 minutes or more. And we start with the 2 days prior to you developing symptoms, or 2 days prior to your COVID test if you don't have symptoms. The 15-minute exposure time doesn't have to be in one period. We look at it over a day. We do this to try and determine who you may have come into contact while you could have potentially made them sick, so that we can begin to notify them. You'll be asked to isolate yourself from others for 10 days and asked if there are specific things you need to self-isolate, such as food, medications, lodging if you live in a house with a large family or other residents where it's difficult to self-isolate. If you give consent, Winding Waters or one of the community-based organizations can reach out and help you with those supports. The 10-day period is the likely period for you to isolate at home. But if you have a fever for longer, it'll be until your fever is gone for 1 day and your symptoms are resolving. That's longer than 10 days. Winding Waters or another community-based organization will notify the contacts that you identify, letting them know that they have been exposed and that they need to quarantine for 14 days. Quarantine means staying home and limiting contact with others in case you develop symptoms, so you do not spread it to others. They'll talk with the person about getting tested for COVID-19, and contacts will also be asked if they need support to stay home. In addition, Landing Waters or one of our community-based organizations will contact the person to make sure they're okay and see if they need any support.
Jonathan, can I just add one other thing?
Yes, please.
So in our experience talking to people, the definition of a close contact can be a little bit confusing. And I just want to highlight one of the things Dean mentioned, which is that it's 15 minutes of cumulative exposure, which can happen in a lot of small increments. And it's also affected with things like coughing or singing or being in an enclosed space like a car. So if someone reaches out to you and says you've been identified as a close contact, you don't always know of whom or where or when that happened, but do know that we're doing that with some very careful questioning to sort out who is a close contact.
Thank you, Dr. Powers. Second question is, what is the level of cooperation in Wallowa County with contact tracing? Dr. Powers?
Okay, yeah, sure. So overall, most people have been really helpful. So the goal of rapid and comprehensive case investigation and contact tracing is really to stop additional spread of the virus. So this protects our family, our friends, our neighbors, and most importantly, helps us to keep our schools and our businesses open and keep our community functioning. So really appreciate all of those people who, when they get a call from Winding Waters or from the state, pick up the telephone and help us. Thanks.
Thank you. Third question, what should I do if I need or want to get a COVID test in Wallowa County? Can I get a test even if I don't have symptoms or any known exposure? Is there a cost for COVID tests? Are there plans to increase testing in Wallowa County? And could we test up to 100 people a week if necessary? Jenny or Dr. Powers?
I'll jump in on that one. Sure. Start with cost. All insurance companies will cover the cost of a COVID test, and Department of Health and Human Services has a program that will cover the cost of the testing for those that don't have insurance. And one little side to that is that covers your general COVID testing. It does not cover antibody testing. If you want a COVID test, we recommend you schedule an appointment, talk with your primary care provider, and they will talk about your situation, whether you have symptoms, you don't have symptoms, if you've had an exposure, if you don't, whatever your concerns might be, and together help you decide, help choose which test would be appropriate for you. And right now, we are very fortunate that we have a large capacity. We do not have trouble with testing supplies at the moment. So yes, we could test 100 people per week. Although large scale testing on asymptomatic populations has not been shown to be that useful. But we do have the ability and will increase our testing as the need arises, and as long as we can maintain those supplies. One thing I'd like to add is we're in a great position with our primary care providers here in Wallowa County. They are very united in their response to COVID-19. They're meeting weekly to discuss the healthcare response, and they are here and will continue to be here for us as we need and take care of our community.
Great, thank you. Question 4 is, will Wallowa County be included in the initial vaccine distribution, or will we be left out because our population is so small? What will happen if the vaccine requires ultra cold storage that we do not have? Dr. Seidlinger, do you want to take that one?
Thanks, Jonathan. Before I answer those specifically, let me comment on the recent developments for vaccine. Both Pfizer and Moderna, two companies that are working to produce vaccines, received some data in the last week about how their vaccines are performing in the latest round of clinical trials. And it shows that there are no significant safety concerns and that they're working very well. That's good news, and we anticipate they will be moving into the next stage of seeking approval, including emergency use authorization by the FDA, so these vaccines will be available for use in individuals. So while we don't know yet when that will happen and which vaccines will ultimately get approved, we do see this as a very good step and something that we can work towards getting through this winter as those vaccines become more readily available. We expect that healthcare workers as well as essential workers will be the initial prioritization to receive vaccines because they're not all going to be released at once. So it'll take some time to ramp up production. And so we would expect that those groups in Wallowa County would also have access to vaccine in this first phase. We don't yet know how many doses or when the vaccine will be available, but we continue to work and communicate with our federal partners. But we hope that by the end of this year or the beginning of next year that we'll have vaccines available for this phase 1 population. And as vaccine becomes more broadly available, we'll move on to other individuals throughout Oregon. In the meantime, we're working with Winding Waters and Wallowa Memorial Hospital on planning for vaccine distribution. Ultra cold storage, which is required for one of the vaccines that was approved, does make our distribution more complicated. And so we're working on trying to make sure that we have that storage available in different regions of the state to address the logistical issues. But just because a county or a region doesn't have that cold storage now does not mean that they will not have access to the vaccines. Those are issues that we are working on very busily right now.
Thank you, Dr. Steinlinger. Question 5 is, please address the latest school metrics in light of how impossible that 5% test positivity rate will be for us to achieve. Will it be possible to allow for a different standard for small counties? Because as it stands, the very metrics that are being touted as allowing for more kids to go back to classrooms will send Wallowa County kids back out of their classrooms. Is there anything we can do to improve the test positivity rate for Wallowa County, such as testing 100 or more people every week? Dr. Seidlinger?
Thank you for that question. I think, let me start a little bit and talk about percent positivity. What we use this metric for is it can be an early indicator before cases rise that there's disease spreading in the community. As we do testing, as long as the testing capacity isn't diminished by supply shortages or a natural disaster such as the wildfires we saw earlier, earlier in the fall, we often see an uptick in percent positivity that precedes the number of positive cases coming up. So it's an indicator that we're testing enough to identify those cases and we can try and act early. In communities that are doing small amounts of testing, the percent positivity can be volatile and may go up and down. We are working on some numbers to better include all of the tests that are done, as for people who test multiple times, those are not all included in the current number. And we're also looking at whether we need to consider kind of changing that metric or looking at it a little differently for smaller population counties, but it is a very important indicator of spread in the community. Currently in Wallowa County, schools were able to open under a rural exception under the earlier Ready Schools, Safe Learners guidance that came out from the Oregon Department of Education that was developed in consultation with the Oregon Health Authority. We released revised guidance in October to try to help additional schools reopen across the state. The schools that reopened under the initial guidance, even if they were exceptions, were allowed to continue to remain open. As of January 4th, 2021, all schools in Wallowa County, as well as across the state, will have to be in compliance with the revised guidance. What we hope is that we're able to flatten this curve. The surge of cases we're seeing right now will be decreasing so that this won't impact significant schools across the state that opened under lower risk with the previous guidance. OHA, Wallowa Memorial Hospital, as well as Winding Waters and the school superintendent meet regularly to discuss issues related to school opening and to staying open. We're meeting again prior to the December break to review the status of the county metrics. And Dr. Powers has graciously made herself available to the school superintendent as a local medical advisor to help provide consultation so we can assure that the students who are returning to school are doing so with the lowest risk and that we're making appropriate decisions about who can continue in school and when we might have to quarantine individuals because of an exposure at the school. The more precautions that the people of Wallowa County take to help prevent the spread of the virus, the more likely we are to have schools remain open for the rest of the year. Two things contribute to the spread of COVID-19 in schools. One is the rate of spread in the community. So as there's more COVID in the community, it's more likely that a student or staff member will come to school with the disease. We are seeing more of that as disease rates increase, but what we're not seeing in Wallowa County or in other counties is significant spread within the schools. The Ready Schools Safe Learners Guidance has strong safety recommendations for how we protect the students and staff in schools from wearing masks, to keeping distances, to keeping cohorts or groups of students and teachers smaller, so that if someone with COVID attends school, we can appropriately keep the people out of school who are potentially infected or exposed and prevent the spread. So we continue to see that in Wallowa as well as others.
Thank you, Dr. Steidlinger. Older folks are at higher risk. Is it safe for family and friends to visit from afar? Jenny?
Well, as we know, rates
one?
are high for COVID across the country. We have concerns for our loved ones of all ages, everywhere, no matter where they're coming from. If you have plans to travel somewhere or someone's coming to visit you, I recommend maybe talking to your primary care provider, find out how best to do that safely, follow the recommended guidelines. And if you do have concerns, the safest thing to do to protect yourself and your family is to stay home and follow the recommended guidelines that have been put out.
Thank you, Jenny. How do we get our health department
So I think we may have lost Jonathan, but let me pull up the list of questions and see what he was reading. I think a question about how do we get our health department back? Can you describe the role that our health department would have played in responding to the pandemic? Before the pandemic, our healthcare system had to absorb the tasks that the health department was doing, reproductive health, immunization, and now add on additional pandemic-related tasks such as contact tracing, public education, and enforcement. Because of the lack of a health department, we risk provider burnout because of a fragmented healthcare delivery model. How can we get our public health department back? So I think I will start with this answer and then turn it over to my partners, because this really has been a team effort in providing public health services to Wallowa County, especially during this pandemic. So per our state law, a decision to transfer a local public health authority can only be made by the County Board of Commissioners. Similarly, Oregon law has provisions by which a board of commissioners requests a transfer of public health authority back to the county. So that is not something that is in the control of the Oregon Health Authority. I think in designing our public health response, we've really seen what resources can we provide from the Oregon Health Authority, and who do we need to partner with on the ground to provide additional services, connections to the community. And I think we've tried to do that very well by mixing additional folks together. So I wonder if Jenny wants to kind of provide some words on what they do, and then we'll turn it over to Dr. Powers.
Yeah, I'll just add to that the pandemic really has been an incredible challenge, but it's also provided the opportunity to show how effective public health and primary care partnerships can be.
Well, as Dr. Seidlinger said earlier, Winding Waters is conducting the COVID case investigation, contact tracing for Wallowa County, and Winding Waters and the community-based organizations are here to support individuals that are positive with COVID, or their families, or someone that's been exposed and is at home quarantining. This support could look like providing a thermometer, to assisting with groceries and many other things. And we're very fortunate to have these organizations. They are part of our community, know us well, and can do a great job of providing that support for us, and have been doing a great job.
Thank you, Jenny. So in addition to exceeding expectations in this vital COVID response work, I think we have an important opportunity to continue to expand the primary care public health partnerships to meet community needs in Wallowa County in the future. And so I'm really looking forward to moving forward, building on some of these relationships that we've made through this crisis. And I think we will be stronger and better because of it.
Welcome back, Jonathan.
Thank you. Sorry about that. I believe we're on question 8. And it is, when is it safe for me to go back to work or school if I've tested positive for coronavirus? Dr. Powers?
Sure. So generally your body is able to fight off the coronavirus in 10 days. So that means that once you've finished your isolation and you don't have a fever for 24 hours, your symptoms are getting better, that you won't spread the virus to others. In some instances, if you're really sick or hospitalized or your immune system is weak, then it can take longer, up to 20 days to fight off the virus. And so you might be asked to isolate longer. So it is important that when you're doing the questions with the health provider that you follow the recommendations for isolation and for your isolation dates. I think some people also get a little bit confused about the difference between isolation and quarantine. And isolation is when you're sick with the coronavirus. And quarantine is when you've been exposed to somebody who has coronavirus, and that virus might be sleeping in your body. And it can wake up between 2 and 14 days after your last contact. And so we do ask, if you have been identified as a close contact, that you quarantine for 2 weeks to make sure that you don't spread that virus to others.
Thank you, Dr. Powers. Based on our location and proximity to both Washington and Idaho, how will Wallowa County enforce the governor's new travel restrictions? We're a tourist destination and holiday shoppers are arriving in droves. How can we protect our vulnerable community from an influx of tourists? Dr. Seidlinger, you want to take that one?
Thanks, Jonathan. The travel advisory that the governor announced this week urges people traveling to Oregon to quarantine for 14 days and stay within their immediate household. The recommendation doesn't apply to individuals who cross the state or county borders for essential travel. Non-essential travel is things that are non-essential travel includes travel that's not considered tourism or recreational in nature. Essential travel includes work and study, supporting critical infrastructure like our power grid, economic services, supply chains, healthcare, seeking immediate medical care, and safety and security. The travel advisory is just that, it's advisory, and recommends that people entering Oregon from out of state take this action for 14 days to protect those around them. We know that not everyone will follow the advisory, so businesses can help protect the community by complying with face covering and physical distancing requirements, putting up signs reminding people to comply with face covering guidance, and providing those to customers if possible who don't have them.
Thank you, Dr. Seidlinger. Here in Wallowa County, compliance with the statewide face covering requirements is mixed, but generally poor, depending on which business enterprise or organization you enter. Who is responsible in Wallowa County for outreach, education, and support regarding COVID-19 risks and safe practices to businesses and organizations? Who is responsible in Wallowa County for the enforcement of statewide face covering requirements when compliance is poor by employees and or customers of certain businesses and organizations? Dr. Seidlinger, you want to take that one?
Thanks, Jonathan. Let me start by saying that masks are an incredibly important tool we have in the fight against COVID-19. When we first started recommending the use of masks, it was because we knew that it would offer protection to those around you if you were sick with COVID-19 and perhaps didn't know it because you didn't have symptoms yet. As we learn more about the spread of COVID-19, we know that these masks also protect you from the individuals around you. So by wearing a mask, you're protecting yourself, your friends, family, and loved ones, as well as the broader community. Some of our local public health authorities around the state have chosen to do outreach and education with businesses regarding the statewide mask requirements. OHA does not currently have the capacity to do that to each business, specifically in Wallowa County. But if we get a complaint about a specific business not complying with the requirements, we will either follow up directly or we will refer the matter to another state agency that has jurisdiction, such as the Oregon Liquor Control Commission in the case of bars and restaurants that serve alcohol, or the Oregon Occupational Safety and Health Administration, or OSHA. If OHA licenses the entity, such as in a restaurant, we can also follow up with the business as we would with any other complaint about a licensee that we have. If the non-compliance continues, OHA and our state agency partners have the ability to take regulatory action, which could include assessing fines and penalties on businesses. And if you have concerns about a specific business, you may send an email with complaint information to covid19.reopening@dhsoha.state.or.us, and we'll get that in to the chat box for you. If you email that address, OHA will get it to the right enforcement agency.
Thanks, Dr. Seidlinger. Without violating privacy protections, how can Wallowa County residents become better informed about the locations and circumstances of coronavirus infections so that they can make more informed risk management decisions in determining how to conduct their essential activities? Dr. Seidlinger.
Thanks, John. Sorry, I was putting the email address into the chat box. I think OHA makes a lot of county level data available on our website. As I stated before, that's www.healthoregon.org/coronavirus. As previously shared, OHA and our local partners aren't able to provide information about specific cases because we want to provide protection to their privacy and confidentiality. But we do have a weekly report that includes information about workplace outbreaks that meet specific requirements, such as the number of employees and the number of cases, outbreaks in long-term care facilities, as well as cases associated with schools. That weekly report is published on Wednesdays and includes all the information on a cumulative basis for those active infections. We know that COVID is in our communities, and all of us have to take precautions to prevent the spread of the disease, such as staying home if we're sick, wearing masks, staying physically distanced from others outside our household, trying to socialize within our household group or very small groups, and avoiding non-essential travel. Also, with flu season upon us, I would recommend contacting your provider about getting a flu shot to protect yourself from that disease.
Thanks, Dr. Seidlinger. When research shows that schools are not super spreaders, why are we changing the school metrics across the state when it is working in Wallowa County? Dr. Seidlinger.
Thank you for that. I think, with the school metrics, we are one of the first states to have some metrics to assess the community level spread to open schools with a lower risk. At the time those metrics were developed, we had data from several European countries and other kind of Pacific nations that had successfully reopened schools. We established a case rate that was in line with those counties, and it was fairly low. In looking at COVID-19 in schools, not just in Oregon after schools opened, but in our neighbors to the north in Washington, who we talk to regularly, and publish reports from other states and other communities, we saw that with appropriate safety measures in place, even if someone with COVID comes to a school, we can prevent the spread of disease in most cases with proper public health investigation and cohorting. Based on that, we made we looked at the data and said we could see more spread of disease in the community and still reopen schools at a lower risk. So this isn't designed to keep students in Wallowa out of school or to keep students in any other county out of school, but it's designed to look at our case rates and allow more people to return to in-person education at lower risk, to stay in school longer as case rates go up if they're not seeing spread within those schools. And I think Wallowa will benefit from the numbers that are in that new policy, because I believe we'll be able to get our rates down before January 4th.
Thanks, Dr. Seidlinger. how are you articulating to OEA how the positivity rate in smaller communities is beneficial for the matrix required for schools to remain open? I think that would be one for both Dr. Seidlinger and Dr. Powers.
Thank you. I'm going to let Dr. Seidlinger speak to the communication with the Oregon Education Authority, but I do want to say that we really appreciate the Oregon Health Authority adjusting metrics to better reflect risk in small communities to start with, and this allowed our schools to open in person for learning this fall. So thank you for that.
Thank you, Dr. Powers. I think the percent positivity can be an important metric, and we've had many conversations with our partners at the Oregon Department of Education, as well as partners on the ground in schools and local public health. I think we're constantly looking at, does this kind of data point reflect what's going on in the community? And in most cases, it does. We are refining the way that we measure and report out percent positivity because we want to make sure it presents what's happening in terms of spread of disease. So this is one of the metrics we look at, along with the case rate, or in the case of small population counties, the number of cases in the previous 2 weeks to determine the spread of disease in the community and whether or not schools can reopen at lower risk.
Thanks, Dr. Seidlinger and Dr. Powers. Why should we not continue with sports seasons into the winter? Safety precautions worked with indoor volleyball. Jenny, you want to take that one?
Yes and no. That is a tough one, and I can say I have personal experience with that. I have a 14-year-old, and she is disappointed that she doesn't get to play basketball all winter. And I would love for her to be part of that team and learn and get some activity. So it's a tough one. But if this is what it takes to keep our schools open, keep those kids going to class, we know how important that in-person education can be for them, then I do think that it is a worthy sacrifice to make for our kids and our community, although it is a tough one.
Yes, understood. Thank you. Shouldn't we be as concerned with our youth's mental health as we are with a pandemic? Dr. Powers?
Yeah. So we are very much prioritizing the physical and mental health of our youth. One of the things we know in-person learning is a way better learning and teaching environment for our students and teachers. And we also know that that ability to connect with classmates, with cohorts is very much important for the mental well-being of our students. I've seen this firsthand. I have an 11-year-old and a 6-year-old, and I experienced how hard it was for them to transition to the comprehensive distance learning last spring. And the struggle that they had throughout the summer with isolation. So we're committed to working with our state partners to keep our schools open as long as we safely can, and taking measures as a community to try and help that. And also just encourage people to know that we have a great network of primary care providers and mental health providers in our community. And in addition to working to keep the schools open, are here to be supportive. Please reach out.
Thank you, Dr. Powers. Last question of the previously submitted questions. Is wastewater testing a good option for our remote area? Wouldn't we be able to gauge the extent of the spread of the disease and track that over time? Up that to the two doctors.
Thank you.
I can.
You start. You want to start?
Go ahead, Dr. Powers. I'll finish up.
I start? Okay.
Sure.
So what we know is we're not sure yet how useful or in what situation the wastewater testing is going to be helpful. We do know that that sort of investigation is ongoing at a state level in partnership with the OHA and OSU, Oregon State University. And one of the things we know for sure is that just because we don't detect the SARS-CoV virus in the wastewater does not mean that it's not in the community. So it may or may not be helpful in that sense. One of the things that we are exploring is a site in Wallowa for this wastewater testing. So we are smaller than the initial criteria for the study that's ongoing, but that is currently under investigation, and I'm hopeful that at some point we'll be able to do that.
Thanks. I think it is one other tool that can help us gauge the spread of, or whether COVID-19 is occurring in a community. It works well when there's very little disease and we can pick up an initial detection of that. It's not perfect, and just because it doesn't pick up COVID-19 does not mean that's not in the community. And if it does pick up COVID-19, we don't know the degree to which it spreads. So we look forward to potentially being able to add a site within Wallowa County to this surveillance tool that we have for COVID-19.
Thank you, Dr. Powers, Dr. Seidlinger. So that's the end of our previously submitted questions. We will now go to the chat questions. We have looks like about 8 minutes to go. So I will see if my colleague Patty has any that she can read aloud, and our panelists can work on responding to.
Good evening, everyone. We have 3 questions that were submitted on the chat, so I think we can get through them all. We'll do our best. The first one, I think we'll start with Dr. Powers. The question is, do any of the resource organizations in Wallowa County offer antibody tests?
Sure. So what I will say is the resource organizations really are for supporting quarantine and isolation, but all of your primary care providers can connect you with antibody testing. So that is a blood test that's available. What's a little harder is the utility of antibody testing. We know it's only about 60 to 80% accurate depending on the test, and that our bodies, even if they make antibodies initially, sometimes that response goes away. So I would just recommend having a conversation with your primary care provider about what you're looking for with testing, and then we can connect you with that.
Thank you, Dr. Powers. The next question, we'll start with Dr. Seidlinger. How likely do you think it is for Wallowa County to have longer than a 2-week freeze period?
Thank you for that question. I think it's very difficult to predict the future, but I think what we've seen in Wallowa County over the last few weeks is that cases seem to be potentially going down. Some of this in the last week, our 2-week period, could be a delay in reporting, but I think it could also be a real reduction in cases. So I would say having a 2-week pause really depends on all of you on this call, as well as your friends and neighbors. If we kind of follow the recommended safety guidance, wear our masks when we're outside of our house with people, and around people that aren't from our household, that we limit our social gatherings, that we really consider, even though it'll be difficult, changing our Thanksgiving plans this year. I think those are all ways that we can keep the spread of the disease down and make it more likely that the freeze won't last longer than 2 weeks in Wallowa County. I like to think of the sacrifices I'm making on Thanksgiving this year so that I can get together with my family next year and talk about what a horrible Thanksgiving 2020 was. Sitting at home alone with way too much food and not being able to socialize. But I can only do that by making the sacrifices this year.
Thank you, Dr. Seidlinger. There's one more question for you, and then we did receive one additional question in the chat box. The third question is, how does a business that has to notarize documents in person conduct this safely?
I will say there's not a prohibition during the freeze or a closure of a notary who has to do documents. I think the best thing to do is limit the amount of in-person time. So if you can meet someone at a door to collect documents or bring them into the room and kind of try and keep 6 feet of distance, ensure that both the customer and the notary have masks on. That may need to be removed briefly while you check an ID to ensure that the person you're notarizing for is indeed who they are, and notarize those documents, and then provide some hand sanitizer for folks after they handle some shared documents so that they can wash their hands before they touch their face or other things. Kind of knowing that you have to get together in person, but limiting the time, using masks and using hand sanitizer after the encounter are ways to lower the risk in those encounters.
Thank you, Dr. Seidlinger. Another question is, if a person who works in healthcare is exposed to a known or presumptive person, is it okay for them to work before being tested? Or is it okay to be evaluated by a primary care physician on a case-by-case basis?
Thank you. I think we have some extensive guidance around exposures within healthcare settings. knowing that individuals are more likely to be exposed because people come in seeking treatment for COVID-19. We recommend that healthcare providers use universal precautions, which could include gloves, masks, and in some settings, face shields or eye coverings to protect them. And knowing that in a hospital setting or another setting with universal use of precautions with no break in those precautions, that a healthcare provider who's exposed to a patient is at very low risk from getting COVID-19. But in settings where healthcare providers aren't using their personal protective equipment fully, or if there's a breach in that personal protective equipment, or they let their guard down when they're in the break room with their colleagues eating without their mask on and there was a potential exposure there, those are instances that put them at risk. And we recommend that they, if they've had contact with someone in those settings who has COVID-19, that they do get tested, that they report to their employer so the appropriate kind of restrictions from work can happen while they're in their potential period when they may have been infected. But I would recommend, yes, if you've had an exposure, talk to your infection control, your manager at work and seek care, and don't come back to work until your manager, your supervisor has deemed that's appropriate. I don't know if Jenny or Dr. Powers wants to add to that.
Sure. So I think the only thing that I would say is we ask all close contacts to quarantine, which means to stay at home. And occasionally those close contacts are essential workers in our healthcare field, and we can't provide life-saving services for people without those people coming to work. So if they are not sick, if they don't have symptoms, but they're close contacts, sometimes if they're needed, they can work, but wearing additional protection, including at the same time a mask and a face shield, and doing gloves, gowns, hand sanitizers.
Jonathan, we have 2 additional questions, but I think we are out of time. So we will write the answers to those and distribute them following this town hall.
Okay, thank you, Patty. And yes, if you have additional questions about, or excuse me, after this town hall, you can send them to questions.townhall@wchcd.org. Again, that's questions.townhall@wchcd.org. And also, just as a reminder, we will post it on YouTube tomorrow. I want to thank you so much for being a part of this town hall. We look forward to hearing any of your additional questions or comments, and we hope you have a wonderful evening. And thank you to the panelists for all the great information.
Thank you, Jonathan. Thank you, everyone, for coming.
Take care, everyone.
Good night.
Thank you.